Welcome to the Plant Free MD podcast with Dr. Anthony Chaffee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. Hello, everyone. Thank you very much for joining me for another episode of the Plant Free MD. I'm your host, Dr. Anthony Chaffee, and today I have a very special guest, Dr. Tro, who's joining me from America, someone I've been speaking to and connected with online many times. This is the first time we're actually getting to sit down and talk face to face. Dr. Tro, thank you so much for coming on.
Yeah, I'm excited. I'm grateful. I was saying it off the air. I'm grateful that you picked up, you responded and said, "Yeah, let's do this." I was a little persistent, and I was like, "Gosh, I don't know. We've never actually met, but I'm appreciative that you're bringing me on, and we can talk and bash fruit and bash whatever, bash the ignorant people." We were just talking about this. The level of ignorance that's out there on social media regarding health and fitness is just astounding.
Yeah,
So I'm happy to be here and happy to shoot the shit, so to speak.
yeah,
Am I allowed to curse,
absolutely.
by the way?
You can, yeah. I mean, it's sort of a family show, but yeah, you can. You can do a bit. Yeah.
All right. Sorry
Um,
about that.
no, you're
Sorry.
fine. You're fine. Yeah. Well, apologize to my children. That's who you need to apologize to. Yeah. No, that's fine. Um, so obviously you have a large online presence. You have a large and thriving medical practice in the States. But for those who don't know you, can you please give us a bit of background? Tell us about who you are and what you do.
Yeah, let's start with the basics, I guess. I'm a board certified internal medicine physician. I practice in a nationwide metabolic practice in the United States. We have 50 state licenses. We have three medical providers in our clinic. We have four health coaches, one personal trainer, about 15 amazing people who work in a metabolic clinic that has been touched. Every single person that's here has been touched by metabolic health. Um, I have board certification in obesity medicine. I am on the board of a not-for-profit, the Society of Metabolic Health Practitioners. I've done grand rounds at Yale, University Hospital, several other hospitals. I lecture nationwide on obesity and nutrition, and particularly around disease reversal. Let's see. I'm a certified personal trainer. I'm a certified health coach. I've published 15 papers. I've been cited, I don't know, maybe 1,000 times. Um, I have a podcast with 10 million downloads. Gosh, I have a social media reach of like 300,000. I have an amazing wife, Rosette, who is just my life, and my three kids, who I'm a loving father of three amazing kids. They're all, Adi, Aline, and Rafi, who I just love and adore. So that's me in a nutshell. I've been on a low carb ketogenic diet, with long periods of strict carnivore, in and throughout that for the past maybe 10 or 11 years. And I've had multiple CACs that have all been clear. And I started down this journey because I was 350 pounds. And I was saying this off the air. My older brother got up to 550 pounds. My mom suffered with obesity, diabetes, cancer, heart disease, all the above. And they, uh, they inspired me to go into medicine to figure out how the hell is our family going to beat this? And for the last 10 years, I've beat this, and so that's my mission, that's my drive. I also work with, you know, I've been working with the HHS on sort of nutrition, and I've been flying back and forth to DC, hoping to make some change around metabolic health and nutrition for all of America. So that's me. But Joe Trainer calls me a grifter online, so don't forget that.
Yeah, well, I mean that's the thing, where you, as you were also saying, off air that you've been doing this for a long time, but you only actually just started taking a salary this year. So if you were, you don't take affiliates or sponsors or anything like that, and so it's like if you're a grifter, you're a horrible one, and you're not doing very well. But I mean that really bugs me as well. When I mean, you can't really let these people say that because I think in reality it's projection on their part. They're not being honest. And when you're doing something, you're actually trying to help people, and you are helping people. It's a bit ridiculous for people to call you names like that, and that's generally projection because they're probably being paid to call you that. They're probably being paid to say that, and a lot of these people are on the take. But we're seeing when people doing ketogenic carnivore diets, people are reversing diseases that are still thought to be completely reversible. We're witnessing a near miraculous recoveries on reproducible, consistent bases, and to acknowledge these results, say yes, 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 yeah, well, yes, people are getting these things, and then dismiss them and say, well, yeah, but it might be bad for you down the road, and this is going to hurt you or something like that. Seeing people reverse all these major illnesses and then say, yeah, but it's still bad for you. It's not only intellectually dishonest, but it's sort of a form of denial that borders on malpractice, I would say. How can especially a medical professional who's seeing this happen in real time, how can they argue that an intervention which reverses heart failure, reverses multiple sclerosis, reverses diabetes, reverses dementia is somehow dangerous? There is no evidence that a species appropriate diet causes harm, and there's an overwhelming amount of evidence that it healed. And to dissuade patients and people from potentially life-saving interventions based on a hypothetical fear somewhere, 20 years from now, or for an ideological, sort of reasoning or financial interest. It's not only scientific. I mean, it should be criminal. I mean, it's insane that people are even doing that in the first place. I mean, how can you be so intellectually dishonest that you see someone put diabetes in remission, which is the number one risk factor for heart disease, and or autoimmune issue go into remission and come off Ozempic, come off their Humira, come off all these medications, come off their blood pressure medication, and say, yeah, but you're going to die of a heart attack. You better watch out. So what the hell are you talking about? Like, how can you say that? I mean, they're either being dishonest openly or living in a world of cognitive dissonance. And so I don't think that you can worry about what those people say because they don't matter. They just don't matter.
They don't matter, and yet they still matter. I mean, like I think talking about the absurdity of the scientific and medical community is important. Um, I think it's really appropriate to do this, right? I'm not kidding, right? We have a chronic disease epidemic in this country, and I'm going to name you headlines I've seen in JAMA and New England Journal of Medicine. Okay. So one of which is it ethical to do a placenta and uterus transplants in transgendered women? Okay. This is in the AMA Journal of Ethics, right? Okay. Two, right? I'm not kidding. Um, Climate change is a cause of mental health issues, right? Is the cause of the mental health increase. And this is in New England Journal of Medicine.
Mm.
Okay. Climate change is a cause of the increase in mental health issues in America. That's two. And then three, I think this is, you know, is BMI racist? This is in the Journal of AMA
Mm.
Ethics. You can look this all up, people. Is BMI racist? Or BMI is racist? That was the contention made. And I'm going to juxtapose this, right? And here's another one, right? I mean, we're dealing with this is a letter to the editor that I wrote, right? This is something that I have specifically written against.
Mm.
The American Academy of Pediatrics supports bariatric surgery, and this is not a joke, and GLP-1 medication in adolescents. Okay, if you look at their guidelines, it says if a healthy diet and lifestyle fail, that consider bariatric surgery and consider hormones. for 11-year-olds. Okay. And they recommend against a low carbohydrate diet. They recommend against reducing processed carbs, sugar, and putting a adolescent on a low carb diet, right? And they recommend that anybody who does it order, and I joke, this is not a joke, 23 blood tests and one imaging study are required
Mhm.
by the American Academy of Pediatrics. This is 2023 before starting a low carb diet. But you can prescribe drugs and surgery, no problem.
Mhm.
So I think when you're talking about understanding the data, right, we're talking about a group of people who, excuse me, injected healthy young kids, and I'm going to get taken off, man,
Mhm.
with a known agent that increased the risk of myocarditis and then denied it,
Mhm.
right? You're dealing with a group that says low carb diets are dangerous. You need 23, lab tests and an imaging study. You're dealing with people who think that our mental health epidemic is caused by mental health issues. They're wondering the ethics of a uterine transplant in transgender women, right? This is the medical institutions that you and I face day in and day out.
Mhm.
So when we're talking about people who are committing malpractice, this is widespread top down. And
Yeah.
I wrote a letter to the editor against the AAP. I sent it to pediatrics. And do you know what happened, Dr. Chaffee? When I
Mhm.
sent this letter saying, you guys are conflating a 5-to-1 ketogenic diet with a healthy low carb diet, they said, we're not going to publish your letter to the editor. This was 6 authors, all physicians.
Mhm.
So we published it in the Journal of Metabolic Health saying these people are crazy,
Mhm.
right? The lead author took $220,000 from the manufacturers of the GLP-1 drugs and did not disclose it.
Yeah. Which is
Didn't
fraud.
disclose it, right? No disclosure was made on her statement, AAP statement on low carb diets. So you're dealing with, and I think, we were talking about, is this like it's an ideologic corruption. I don't think these people are thinking like nefariously. I think ideologically, our institutions have been so captured.
Mhm.
Our colleagues are so far gone that it's almost to the point of no, there's no coming back. You cannot reform the AAP. You cannot reform the
Mhm.
AMA. You have to hit the reset and start over.
Mhm.
It's too far gone. So when we're dealing with nutrition, I've written the letters to the editor. They won't even entertain it. We have to publish in other journals, right? So how does this happen? Right? I'll tell you how it happens, and this has happened before, right? And you know this story, right?
Mhm.
There was a doctor. His name was Semwise. Do you know the
Mhm.
story of Semwise?
Oh yeah.
Right? So, and I'll tell it for the listener, right? He was a physician. I think he was a surgeon, obstetric surgeon, right? And an OBGYN. And he noticed that after he washed his instruments, that he was getting better outcomes, right? And he went to like his colleagues and he went to the medical community, said, guys, I think there's something invisible on our hands and on our instruments, and we wash them away. You guys don't see it, but trust me, it's there. When we wash them away, you get better outcomes. And look at my outcomes compared to yours. I'm doing better. You guys aren't doing so great. And all you need to do is just watch what I'm doing. And they literally drove him insane. They committed him. I think he eventually committed suicide.
Mhm.
Right. So, what's the moral of the story? The moral of the story is, and this was even recently. Marshall, the guy, the doctor, the scientist who found H. pylori
Mhm.
as one of the causes of, peptic ulcer disease.
Mhm.
He literally had to. They crucified him for years. He literally gave himself the bacteria, gave himself the disease, and then reversed it. So these are the people we're up against,
Mhm.
right? These are the, I guess, the monsters we're really up against. And honestly, I don't, I like, I'm trying to put myself in their position. And we were talking about this off the air. I don't think any of these people, like, think about that person back in Samwise Day. Some guys like, you're not seeing what I'm seeing. You don't have the imagination to understand. I'm doing better than you, and you suck, right?
Mhm.
If I'm that doctor, well, if I'm that doctor, I know I'd say I'd be curious, like, tell me what you're doing. But I understand why docs like you and me have to struggle to get our message out
Mhm.
because we're dealing with a machine that's just insane, right?
Yeah.
And when you listen to this, if you're the average listener, you don't understand how pervasive this is. I mean, and but everything I just said was true. You can fact check
Mhm.
me if you want, you know.
Yeah.
Um,
Yeah.
but you know all this, Sorry
Yeah.
if I was a little too inflammatory for the
No.
podcast.
No, you find, it's interesting that, the guy who figured out H. pylori is here in Perth, where I'm at. And he was a doctor at the Royal Call or at the Perth Royal Perth Hospital.
What was his first name? I know the last name is Marshall, right?
I can't even remember this one. There's like a
Yeah.
poster about him in like it's like the sub
Yeah.
basement at Royal Perth.
Yeah.
And but I spoke to people who knew him, and not only did they ostracize him while he was coming up with this idea, and he said, you know what, screw it, I'll prove it to you. I'll drink the stuff and give myself this, and then I'll reverse it. Got the Nobel Prize for it. And so,
Years later.
yeah, but
Yeah.
did something dramatic and changed the face of medicine. Even then, apparently he was a bit ostracized by his colleagues here in Perth. And so now what he does is he actually holds because in other countries anyway, and here, but certainly he other countries. So you have a Nobel Prize. People just want to see you. They'll just pay big money to see you. So he holds clinics like up in like China or Singapore. Or something. I can't remember where it is. Maybe Hong Kong. Anyway, goes into like South Asia, and he'd just go up there and he holds clinics up there. And I think these billionaire businessmen, things like that, they will pay whatever the hell they need to go see a gastroenterologist with a Nobel Prize. Because that guy must be the man. So outside of his own parish, he's thought to be this amazing person, but inside his own world in Perth, apparently all his colleagues were like a bit grumpy at him, and so he just went, "Fine, screw it, I'll go somewhere else." And yes, you see this, but the thing is, what I was saying about what doesn't matter is, the people in the comments going, "Oh, you're mean." That doesn't matter. The 99% of comments saying, "Hey, this changed my life. I've lost 200 pounds. I've come off my medications. I don't have autoimmune diseases anymore. I'm not having to take medications every single day just to survive." Those are the people that matter. And it may be hard for us to get ostracized by these people, not have our voices heard because people are trying to keep us out of an old boys club or they're being paid to keep us out. That sucks. But you know what? We're still able to help people. We're still able to reach people, which is great. I mean, you have 10 million downloads on your podcast. That's 10 million people that you've reached that these assholes couldn't keep you from. And that's what's important to me. You keep that eye on the prize. It's like there are people that you are reaching and there are people that you're helping. Semmelweis went crazy because no one would listen to him and he didn't have an outlet. And he observed that because everything was about cadavers, about autopsies back then. You didn't have CTs, you didn't have MRIs, you didn't know what the hell was going on inside the body until you cut it open and looked into it. And so everyone was doing autopsies all the time because that's how you figure this out. This guy had these symptoms and these things. Okay, let's cut him open and see what the hell happened. And what they were doing was that, and everyone was basically a general doctor at the time, 1800s. And what he noticed was that people were basically in the cadaver lab all the time doing autopsies and things like that. And then someone would come in at any given time having a baby. They'd go straight from working on a dead body to go and delivering a baby, and they had like 25, 30% maternal fatalities, right? Massive infection rates. And he found just washing your damn hands. saved these women's life. The infection rate went down to almost to zero. And so he was, because people were just like, oh, you're crazy. He was, head of medicine or whatever. He was in charge of the hospital at the time. He would stand in front of the delivery ward and accost people and be like, you, and force them to wash their hands because he knew that this was so important. And so, he had to force it, and it worked. They infection rates dropped dramatically, but he had such pushback, and he just, they were just, not listening to him, that he couldn't affect his message the way that you and I can. And we just show this evidence. There are people that are going to take this up. There are doctors that are taking this up. I'm sure you get the same thing, but I get messages on LinkedIn and elsewhere from physicians saying, "Hey, this changed my life, and I'm changing my whole practice." I've had doctors that OBGYN actually had him on the podcast, said that he was changing his whole practice. He was going to stop doing surgery and all this because he was starting a metabolic health practice because like this just works so well, and this just is what helps people.
Hey guys, just want to take a second to thank our sponsor, Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. But for those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right, thanks guys.
I've seen people that are basically so disillusioned with the medical fraternity and doing everything they can to help these people in the way that they've been taught, and just people are just getting worse slowly, but they're getting worse. And then all of a sudden they see this, and all of a sudden it just revitalizes their interest and compassion and humanity in this profession, and say like, okay, I can do this now. I'm not just spinning my wheels and doing everything I can, and people are getting worse. So those are the people that matter. And we know that the literature is corrupt because it's been corrupted because there's corporate capture. These these multinational industries, the food and drug companies, they are the major sponsors of these journals like the Lancet, like New England Journal of Medicine, and they pay a lot of money to to influence those papers. And so I've spoken to a lot of researchers from MIT, and there's a Dr. Stephanie Seneff who has been at MIT for over 40 years. And she was saying that like they were running into this, that basically when she was doing research on glyphosate, that the powers that be that were going to get their bottom line hurt by their paper on glyphosate, they were able to influence the papers, and the paper were like basically, oh, we can't publish these things anymore, because our sponsors are going to pull funding, right? Um, and so, you see that, there've been, I mean, this is people have come out publicly about this too. Um, Dr.
Well,
Horton.
I just want to come in right here because this is why, and I don't mean to interrupt, but
Mhm,
5 years ago or 6 years ago, we started the Society of Metabolic Health
mhm,
Practitioners in the United States, which now has 3,000 plus members, hundreds of doctors, hundreds of health coaches. We certify docs for health. It's a not-for-profit. They put on, we have ACCME. We got this just this year, ACCME PR1 accreditation, right? Which means we can officially give any doctor CME in the entire country. We have a journal called the Journal of Metabolic Health, right? Which we started several years back. We sort of merged with the Journal of Insulin Resistance. We have about 100 publications a year. We have our own journal with our own editorial board, right? So we're shifting, right? We
good.
cannot just like stand by and just
Hmm.
let like that doctor you just talked about
Hmm.
needs a peer group.
Hmm.
And we made the peer group, right? We made the peer group. We have two conferences a year, one in Boca, one in San Diego. We made that peer group. We made the journal. We made the education platform, right? So, and we need to just start over. We need to hit a reset button,
Hmm.
right? Because we cannot do this. And it's been a struggle, 10 years, I've had my clinic, this nationwide clinic, for 10 years. We have, maybe touched over 2,000 plus lives. We have multiple docs. And, the thing that got me was nobody's going to believe me. I have to put out results. So right? We published on disease reversal so people could just see it. And we started with the easy stuff,
Hmm.
right? We started with hypertriglyceridemia. The NLA says if you have a triglyceride level of 1,000, you should never do a low carb diet. We took those people with 1,000 and we walked them down week by week and until their triglycerides came down on a low carb diet with intermittent fasting. Right. Then oh, you can't, diabetes reversal is all weight loss. We took people
Hmm.
who had a total of 8 pound weight loss. We did a case series of patients. 8 pounds on average was like nothing. It was less than 5%. Okay. And they went low carb and they completely reversed their quote unquote diabetes, average A1C of 9 and change down to A1C of 6. We published it. Right. And then I was like, it's not enough. It's
Hmm.
not enough. I went and I published a series of 50. First, it was 12 patients in one company that partnered with us. We showed that we saved the average employee there $4,000 in drugs they didn't need anymore, right? A year. So we actually saved the company money. They paid for us and they got money back while their employees got healthier. Then we did it again. We took 50 consecutive patients and we published in Frontiers. It was the most widely shared article in Frontiers this year, right? The average person coming into our clinic lost 43 pounds after 1 year. Their A1C dropped by 1.1, which is, and I don't know what system you guys use, whether it's millimolar or percentage or whatever, but it's a 1.1 A1C drop, and the average blood pressure drop was 17, the systolic, right, which is crazy,
Which is great.
right? And it was 1 year. You can't say it's
Hmm.
not long term, right? Then we published data on food addiction symptoms, binge eating symptoms, essentially resolving 80% resolved at 1 year. And the data I'm most excited about, is we have data coming out showing a massive cardiovascular risk reduction. I don't want to go too much into it, but we looked at 100 plus consecutive patients and we did what the AHA asked us. We calculated their disease risk, their 10 and 30-year disease risk, right? One when they came to us and 1 year later. And the risk reduction is more than most of the medications that are blockbusters, right? Like light years more, right? So, and you talked about like autoimmune disease, and I just like if there's a listener out there who's like, oh, you can't reverse autoimmune disease, I just want to discuss the data for a second, right? We have now in 2026 data showing meta-analysis data showing that, a keto carnivore diet reverses PCOS,
Hmm.
meta-analysis data reverses depression with a strong signal in anxiety. This is meta-analysis data. That particular paper is published in JAMA this year, JAMA Psychiatry. We have meta-analysis data that it improves glycemia and diabetes better than any other diet. We have head-to-head data showing that it gets people off meds better than Mediterranean diet. We have head-to-head data with a keto carnivore diet that it improves blood pressure more than the DASH diet. And you mentioned autoimmune disease. We have literally head-to-head data showing that a low-carb diet reduces TPO antibodies and reduces MRI-confirmed thyroid, Hashimoto, like autoimmune thyroid disease, right? The actual inflammation in the thyroid, right? This is all data we have now. So no doctor can actually go and say, this diet's going to hurt you.
Yeah.
There's no evidence of that,
Yeah.
right? There's only evidence of benefit.
Yeah.
Sorry, I had to go on my rant.
No, but that's really important. I mean, because the main thing that people say is like, well, but your LDL will go up. Therefore, all of these benefits don't matter. It's like, well, LDL is not a disease. Atherosclerosis is a disease. And so, one does not necessarily beget the other. I mean, even if we're saying that higher LDL in certain circumstances can be contributory to atherosclerosis, you can't say it happens in all cases. And also, if you're reversing diabetes, if you're lowering blood pressure, if you're improving your homocysteine, which is it causes direct damage to your arteries by increasing your B vitamins like B12, you're lowering your risk factors for cardiovascular disease. So even if there was an increased association with LDL, which actually shows that there isn't. I mean, it's randomized controlled trials showing that so like the Minnesota coronary experiment, the Sydney heart trial, I mean, these are both large scale randomized controlled trials. The Minnesota coronary experiment was a double blind placebo controlled trial with 9,400 patients, so nearly 10,000 people. And they replaced animal fats with vegetable oils. And they found that for, what was it, it was sort of a certain drop in cholesterol levels. You had a 22% increased risk of cardiovascular accidents. And so, in a dose-dependent relationship, that the lower your cholesterol went, the higher your risk of having a cardiac event. So you really can't say that. It really isn't supported by the data that in all circumstances, no matter what, cholesterol is definitively a cause of heart disease. You can't say that. But you're reversing all of these other direct known causes of cardiovascular
Well,
disease.
well, well, let's talk about that for a sec. If you take a look at the PCSK9, so I
Hmm.
can give you an injection drug that'll bring your LDL to 40,
Hmm.
and you will have nearly the equal amount of cardiovascular deaths, whether you're on placebo or on a drug that brings your LDL to 40. Nearly equal.
Hmm.
Like not statistically different. And you will have no, after 5 years, you will have no difference in dying or living more
Hmm.
on a drug that lowers your LDL by 100 points, right? Full stop,
Yeah.
right? So I think this concept of LDL lowering, there's some interesting data, there's some interesting data around it. It appears to be, genetically, like there appears to be a genetically linear relationship. The drug data kind of points in the same direction, right? That if the LDL goes down, maybe cardiovascular events goes down if you line up all the different drugs. So there's like a bit of data around, sort of all sides. But when you look at the sort of population data, it's a U-shaped curve,
Hmm.
right? It's a U-shaped or J-shaped curve, I should say.
Yeah.
Meaning like there's probably some nuance there. And honestly, if you back out obesity, diabetes, hypertension, right, metabolic disease, I think this becomes a an insignificant discussion,
Hmm.
right? So look, if your LDL is elevated, we published on that. It
Hmm.
was it was our case series from our clinic that showed how to reduce it,
Hmm.
right? You're not going to love it, but it's
Hmm.
reintroducing, 20 to 30 grams of carbs. That's all it took,
Hmm.
right? That's all it took, right? That was the study back in 2022 with David Ludwig, Dave Feldman, Nick Norwitz, and Adrian Sotomoto and myself. And we showed how to reverse the quote unquote hyperlipidemia in a ketogenic diets. And we have another study coming on out in the next 6 months on this, on the genetic underpinnings of why this happens.
Yeah.
But it's not an issue,
Mm.
right? And we have screening tools, and that's one of the reasons why, I was looking to connect on this. We have screening tools to help people see if they have disease or not, if this is
Yeah,
something they should even
exactly.
consider, right? Like, because look, if you have no coronary calcium, if you put an ultrasound on your neck and your carotids are clear and your intima
Mm.
is not thickened, it's not that you don't have to, like, you can eyes closed, not worry, but your risk is really low.
Hmm.
And one of the things I'm passionate about is making medicine easy and accessible. Like our practice has remote scales, cuffs, CGMs, right? You can text in, get immediate feedback from your coach, doctor, just accessible. We have our own app, we have our own software, we have AI tools literally looking to see, can we predict when people are deviating from the diet and help them, right? This is our clinic model. but we're like taking another step, like a step, one step further. Because we're nationwide, and in the United States, the medical system's split up into 50 states. Because we have 50 state licenses, we're launching a nationwide metabolic screen because I get calls every day, every single day saying, I wanted to get a CAC. I wanted to see how worried I should be about my cholesterol, and my doc won't order it. I wanted to get an NMR lipid panel, and I wanted to check a fasting insulin, and I couldn't get this. I wanted to see, if my LPA is elevated. I wanted to check my homocysteine, the lab you just talked about. Well, we're launching a screen, okay, nationwide to literally help people anywhere in the United States get easy, convenient cardiovascular risk screening and labs for like an insanely low price. And I don't mean to sound like a salesman. So if I am, you can edit this out, But
Fine.
if it's not, I think it's, so I'm proud. I'm actually proud.
Mhm.
I'm proud to do this, like affordable, easy. You can text message and anywhere in the country get labs and imaging. Because honestly, it's too hard for people. Like we just described the AMA, the AAP, right? We described the AAC, the ADA, which barely supports low carb diets, right? Imagine dealing with a doc in the box, right? All those docs we talk about that Sam Wise had to face, Marshall had to face, like people don't want to do it, right? So I'm all for making things easy for people because they have enough shit to deal with, and I talked about this with you offline. My mom was gaslit. I saw her struggle with obesity her entire life. She had diabetes for 40 years.
Mhm.
Okay. My older brother by the time he was 13, he was already 300 pounds. I was 200 pounds at the age of 13, 210 pounds, the current weight that I am right now at the age of 13. I literally watched my whole family suffer. I went to Weight Watchers with my mom at the recommendation of her doctor, who told me when I was 13 and overweight to go count my calories, right? Meanwhile, I was explaining to you like I could recite calories like the back of my hand. And I went through all of medicine because I didn't want my family to suffer. I didn't want to suffer. I wanted to figure this out. And I got to be a 350 pound, fat, sick, like every part of my body hurt. I was a chief resident. I got a 90th plus percentile on my board exam. I was, you couldn't educate me more in their system.
Mhm.
You couldn't ask for more. I was the chief resident, Yale affiliated program, board certified internal medicine, scoring on the top of my field. There was nine out of 100 doctors scored better than me, right? But I'll tell you, there was no wisdom on disease reversal. It was only disease treatment, right? And it wasn't until I went to the literature and figured out all the bullshit, all the lies that they used to gaslight my family. My mom went from Weight Watchers to fen to Ozempic to bariatric surgery to then Ozempic, only to get cancer and heart disease, right? And honestly, the reason why my practice exists is so nobody has to go through that ever. And nobody has to deal with being gaslit by a medical doctor,
Yeah.
So I'm proud, it's tough enough and they don't even know the data. I know you're
Yeah.
like you're like Dro, when get off your rant here, but
No, you're fine.
they don't even know the data. Like I just
No, they
talked
don't.
about all the data this year
Hmm.
that shows the benefits of a ketogenic. They don't even know it.
Yeah. Yeah. They only
Uh,
know what's been spoon fed to them, And I mean, as you know, I mean, we get spoon fed a lot of information in medical school, and we have to regurgitate this to pass our exams and our USMLEs and boards, etc. And then you get into a residency program. Again, you're just stuffed all these you need to read these seminal studies. You need to read these whatever, and then regurgitate that for the board exams as well. So and then you've all done that in high school and college and things like that. So now, okay, you're in your 30s, and your entire life has just been about taking in information that someone else curated for you and then regurgitating it out. And that's the only thing that matters because all you need to do, you just need to pass your test. And so you just think, well, obviously I'm getting told the best information because they teach this to me if this wasn't the best. If there was something better, they would have taught me that. That's putting a lot of faith in people that you've never met. And of course it's not going to be true. It's somebody's opinion. And at best, it's someone's opinion, because in reality, it's influenced by different interests, generally multi-trillion-dollar companies and industries. So they don't know this stuff because they've never looked into it because the education they've gotten has been just spoon-fed to them. And now, as doctors and clinicians, what sort of research do they do? What do they do? Any independent? No, they go to conferences that are bought and paid for by the same people, and you still same regurgitation. We're just same spoon feeding, and then they have drug reps coming to their office and buying them lunch every now and then, talking about a certain study that promotes their product. And I can't tell you how many times that I heard doctors say, "Oh, I love Tuesdays," and I'm like, "Why? Because free lunch? Like what?" So it's like, no, because it's like research day. I learned all the new research. I'm like, this is a salesperson, right? They're just trying to sell you a drug. So they're going to tell you the research that supports the sale of that drug. This isn't like the research wing of your hospital. But people don't realize that. They think that everyone's just in this collegial, sort of fraternity. We're all just trying to help people, and this is the best information. If it wasn't, then the drug companies would do something else, obviously. Of course they wouldn't. They're about their bottom line. And we know that they don't try to cure things because they've said they don't try to cure things. Goldman Sachs had a leaked slide from one of their board meetings or whatever, saying, is curing someone of a disease a viable business model? And I was like, no, of course it's not, because you only get to treat them once and that's it. So you only make money from them one time and you cure it and then it's gone. Whereas if you just treat the symptoms and you never cure the disease, then you have recurring income and revenue forever for the course of their entire life. And so that's the business model. That's the business model. And that's unfortunately what doctors have been sucked into. And we think that we're there because we're trained to think that we're there helping people and this is the best information that there is. But really, we're just on the ground drug pushers. We've got the cartels like Pfizer and Merck, et cetera. They're the cartels. We're the equivalent of the guy on the street corner pushing the drugs on the street. We're direct, customer interaction, and we're the ones saying, "Hey, this is what you want. This is what I got for you." That's what they've turned us into. And I had a friend of mine. His dad was an ENT surgeon, and back in the '80s when everyone had pagers and things like, or '90s, whatever. And so he had a pager, and the only people that had pagers were like drug dealers and doctors at the time, right? And so he was at a gas station, and someone just called out to him and was like, "Hey," I was like, "So do you sell drugs legally or illegally?" And he just sort of laughed. He's like, "Legally. I sell them legally." And that's really what it is, And it's just legalized. It's a legalized drug cartel. The corruption in the literature is really good that you just branch out. It's like, okay, we're not even going to deal with you anymore. We're going to start our own because you have to. There's Dr. Horton, Richard Horton, who is or was editor-in-chief of the Lancet for years. And he said specifically that medical research is unreliable at best or completely fraudulent. I'll read a couple quotes from him and the editor-in-chief of the New England Journal of Medicine. So Horton said, much of the scientific literature, perhaps half, this is a direct quote, perhaps half may simply be untrue, afflicted by studies with small sample sizes, tiny effects, invalid exploratory analysis, and flagrant conflicts of interest, together with an obsession for pursuing fashionable trends of dubious importance. Science has taken a turn towards darkness. And he said that at least half of the literature is just flat out wrong. And that is echoed by many other people. Professor Ioannidis at Stanford, the top epidemiologist in the world, he's said very similar things. Dr. Marcia Engel, who's a physician, longtime editor-in-chief of the New England Journal of Medicine, she said again, and I quote, It is simply no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. Guidelines. Everyone just goes after the guidelines, but you can't trust them, as per the editor-in-chief of the New England Journal of Medicine. She goes on to say, I take no pleasure in this conclusion, which I reached slowly and reluctantly over my 2 decades as an editor of the New England Journal of Medicine. So this is not a conspiracy theory. It's not just you and I that have seen this. This is the people in charge of the best journals on this earth that are saying this, that their journals are corrupt, that their journal, you can't trust them. And, we're supposed to practice evidence-based medicine. The evidence is their evidence. Okay, so that's already flawed. But then the guidelines generally follow 10 to 15 years after the evidence. So if you follow the guidelines, you are by definition 15 years behind the evidence. And if you follow evidence-based medicine, you are at least 2 to 3 years behind the cutting edge. Because even if we trusted all these things, you still have to wait until the studies are done. You spend several years and then you get it published. Okay, so the cutting edge was 4 years ago with a guy that said, hey, I'm going to try something new, right? So you're basically about 20 years behind, and that's if you can trust all these things, which you can't. So now we're looking at the guidelines, going, well, you have to trust the guidelines. The guidelines are it's a guideline. It's to guide you. If you know nothing, if you are just completely new to this, just follow the guidelines, and at least you can go in that direction. You won't get sued if you mess up or if something goes wrong. At least you're protected legally. That's what guidelines are for. It's for people that are very new to the game, that don't know enough to know how to say, hey, I think this is better. That's what guidelines are for. But I've spoken to so many people that have said, "Oh, I would never go against the guidelines." Guidelines are 15 years behind the evidence. You should be following the evidence. What if there's studies and meta-analyses and randomized controlled trials showing that those guidelines are wrong? Like you should only eat 10% of your calories from saturated fat. And yet there's a systematic umbrella review of meta-analyses of randomized controlled trials published in Journal of American College of Cardiology in 2020 showing there's no correlation, certainly no cause and effect relationship between increased saturated fat and cardiovascular disease. And in fact, they found a protective effect between higher levels of saturated fat consumption and stroke. It protected against stroke. You had less stroke. So that's the evidence. That's what the evidence shows, but the guidelines don't reflect that. And so if you're following the guidelines, you will be behind the evidence and you may be doing something wrong. And yet people just follow the guidelines sometimes. I spoke to, I think it was a gastroenterologist here in Australia, and he was saying he got into it with his head of department because they were getting concerned about him doing a low carb medicine. He said, well, look, this is the evidence. Look, this is randomized controlled trials. Here are the meta-analyses. Here are the things that show that this is really efficacious for patients. And I'm getting better results than I've ever gotten before, than anybody in the department's getting. And his head of department said, I don't practice evidence-based medicine. I practice guideline medicine. And that doesn't follow the guidelines, which is completely backwards. And so, it's really important for clinicians like yourself to make a stand and just say, this is wrong, this isn't good. And to not only, try to correct that by publishing studies and publishing the evidence so people can follow evidence-based medicine, but also start influencing, working with HHS and trying to affect the guidelines, obviously, because those are very corrupt. And 19 out of 20 people that were on the board last time had financial ties to various industries, food and drug companies. You can't do that. You can't have people that have financial ties to anything be involved in these guidelines. And so putting out evidence so people can follow evidence-based medicine if they're smart enough to do that and do some independent research. Because that's when I started getting into this, going like, okay, I realized that biologically humans are carnivores. And I'm massively improved my health and my family's improving their health. Okay, what do we know? What can we improve? And there's an entire world of information that I was never introduced to in medical school or residency in low carbohydrate, ketogenic medicine, and all these so many other things. Randomized controlled trials showing you can put Crohn's into remission without medication just by putting them on an elemental diet, just or getting rid of carbs and fiber. people staying in remission up to 51 months without medication. These are studies were done in the 80s. Like we've known about this for decades. And yet, no one knows about it. I talked to gastroenterologists, so well, that's just not that there's no evidence to support that. I'm like, really? You haven't looked at the evidence then. Clearly, you've just been spoon-fed and then regurgitating, your Gerber medical baby food. I mean, it's just not, that's not what the evidence shows. So getting out there and starting a new journal and just sidestepping that and just getting away from the corruption and starting new industries that don't have corporate capture. There's the new diabetes, what is it, the diabetes, not diabetes association, but diabetes society maybe in America that Dr. Barry started. They take no industry funding. And so, they're saying like, look, this is actually how you treat diabetes. Like the standard diabetes association that's Nestle and Coca-Cola and other processed food industries and drug companies are major supporters of. Their recipe book is just insane. I mean, I guess it's great, if you want to support diabetes and make it more prevalent, then definitely follow their recommendations for how to eat because they're talking about adding sugar to like a cucumber salad. You add, like several tablespoons of sugar to this. It's just like, why are you doing that? Like, obviously, that's not beneficial to a diabetic, which is a problem of excess blood sugar. And so, but yeah, but if you want people to have diabetes, yes, definitely listen to listen to their recommendations. So you have to go outside of that. You can't get in there and say, hey, look, stop the corruption, stop taking, millions of dollars from these companies, because they're not going to do that. They're just not. And especially with the AHA, the American Heart Association, I mean, they started on fraud, getting paid the equivalent of $20 million from Procter and Gamble to just make up a story that Crisco and vegetable shortening were healthy for the heart and that their direct competitors, butter and lard, were not healthy for the heart, based on no evidence. They just said it, and they've done that since then. They've always been corrupt, and they're still corrupt. And so you can't win that back. You just have to let it, go over there. You have to outcompete it, and that's, like sort of the market system. You make a better product, which is like, hey, how about cardiac guidelines and diabetes guidelines that actually work and actually help people get rid of and prevent diabetes and heart disease? Then you outcompete them, and they have to adjust or die, and hopefully that happens sooner rather than later. Sorry, I went on my
I
own
mean,
rant.
no, no, no. Look, everything you said, I 100% agree with. I think, forget about the fact that just take for a second and just assume, okay, the medical literature um, has problems, right?
Mhm.
The publishing industry has problems. Pharma is able to fund research on a level like I literally had to self fund.
Mhm.
10 studies we've done, I have funded them all myself. I had to pay, right? I have to pay these access fee. I have to pay. Also, other people can see what
Mhm.
we're doing and then reproduce what we're doing, right? Which is like the least competitive, like anti-grifting, it's like come do what we're doing. We literally set out and said, here is what Toward stands for, right? Here is the stack that we do. Go do the same thing,
Mhm.
right? And so just take a second and say, all right, fine, it's a flawed system. There's going to be half truths, truths, and then just falsities, right? 50% will be false, right? And then go back to the point you said, right? It takes 20 years, right, for that data that just got published, that, JAMA Internal Medicine, sorry, JAMA Psychiatry was published this year that ketogenic diets improve depression, right? How long will that take to come into the Psychiatric Association or the APA, the organization that, basically put out guidelines on toxic masculinity, said that waterboarding is legal and ethical. How long will it take to get into their, guidelines? Maybe decades, maybe 2 years. So that's 20 to 30 years, if at all, that you will be gaslit by
Mhm.
the medical establishment, right? And this is the problem, right? Like this is why there's so many people. This is why people come to our practice because they understand this problem and yet they still need help. And it's not absolutionist. Like, we have like I was talking to somebody about medications, right? Like I stepped on a rusty nail, right? And I gave it a day or two. I said, let me look at this thing and let me see what happens. It's just rip roaring painful the next day. And then it's getting even worse. So what did I do? I took an antibiotic. Had it gotten better, had the redness stayed where it was, right? I wouldn't have taken anything, right? But it got worse. My body was not healing, right? So I took a medication, right? But the problem with medicine is we prescribe antibiotics so much. The IDSA, the Infectious Disease Society, has to come out and tell docs, you're prescribing antibiotics too much. You're
Yeah.
messing stuff up. You need to stop. That is the culture of medicine we're in, right? We're in a culture where there's a decades long gap between the evidence becoming something that's, you know, we can put into practice, and even more for lifestyle, right? Atkins knew what to do with lifestyle, and he knew what
Mhm.
to do with diabetes decades ago, right? And it took until 2022 basically to show up in the ADA guidelines, right? But that's not even dealing with the inertia it takes to change practice, right? And it's a corrupt practice. We are drug dealers. We're lemmings. Most doctors are just good at following orders,
Mhm.
and it's sad because um, I empathize. I empathize. Like I was one of those people. Like I was good at following orders. I was a chief resident. Like I was an arrogant shithead once, right? But I had to change. I had to see the light. Uh, 13 years ago, I had my son, 13 and a half years ago, and I didn't give him the hepatitis B vaccine. And it was like I committed a crime at Yale.
Mhm.
It was like I committed a crime. I didn't take the flu shot for 13 years because I'm a healthy young male, right? Like I'm not going to expose myself. The risks they're not there for me. If I was 65 and I had known heart disease or just had a heart attack, maybe I would take it, maybe, right? Just like with the antibiotic. I'm not going to, I've taken maybe antibiotics 3 times in my adult life, right? I mean, like maybe 3 times, maybe once.
Mhm.
I'll take that. I'll take it twice. I had a spinal surgery with an infection in my spine and I needed antibiotics. And then the second was, this foot infection. Now, so it's not being absolutist. The medicines are great. There's a patient that can benefit, but it's the culture of doctors that is just wicked and terrible, right? We're not thinking for ourselves. We're not thinking deeply. We're not thinking for our patients. And this is why we started SMHP. And this is why I went into independent medical practice. Anthony, I opted out of Medicare. I opted out of CMS. I have never taken any, not even a lunch from a pharma rep ever. Sunshine
Yeah.
Act, I don't even
Me
show
either.
up,
Yeah.
right? I we practice completely independently, direct to patients so that we can be without conflicts, without interest. I want my patients. So why do people come to us? I make money when you live longer and healthier. That's it. If I'm not serving you, you leave, right? I'm on the hook. If you don't lose 40 pounds in a year, that's the average weight loss in our clinic in year one, right? You just leave. And we've gotten so good at what we do, companies now pay for us. We have people all over the country, truckers, manufacturers, because their companies are coming to us and saying, "We've seen the data that you not only save money, we have data on quality of life." Anthony, this is going to blow you away, and I know it's not a surprise to you.
Mhm.
The average person coming into our program feels unwell 19 to 20 times per day. They feel unwell out of the month. Out of 30, sorry, they feel unwell 19 to 20 times per month.
Mhm.
Out of the 30 days, more than half, almost two-thirds, they feel unwell. right? After 6 months, the average patient feels unwell 2 days out of the month. Like
Nice.
we're literally giving people 50% of their life back. You can't quantify this. This is a blockbuster. This
Yeah.
is a this is a multi-billion dollar drug,
Mhm. Yeah.
right? If I could package it and sell it. But I mean, it's the best job ever. And I
Hmm.
work with docs, Dr. Laura Buchanan, who's also on the board with me at the SMHP, Mary Duganzik, who wrote, she's our PA. She wrote a paper on keto and Cushing's, and she's helped us with other posters that we've presented at other, medical conferences. And I have four amazing coaches. Our lead health coach, Brian Wall, I was talking to you, 2 decades, he's kept 100 pounds off.
Hmm.
Amy, I guess, is our senior vice president of corporate wellness. She's lost 220 pounds, right? No surgery, right? No drugs, and she's kept it off for 8 years, right? We have Vic Bismagian, who's, I don't know what to say. He lost 100 pounds. He's kept it off 8 years, right? He's in retirement. He's retired. He doesn't need to be doing any health coaching with us because he just wants to save people. We have Tia Reed. She's like the food addiction expert. She lost 90 pounds, came off of 20 plus drugs, right? This is our team. And it's funny. We were talking about this off air before we started. This is the grift, apparently.
Yeah.
This is grifting,
Yeah.
giving people 15 days back that they feel well where they previously felt unwell, helping people lose 43 pounds a year, dropping their blood pressure 17 points as they come off on average two medications. I haven't said this anywhere, by the way. This is new. We actually this year we're launching a service guarantee because we know how to do this.
Hmm.
Where we're actually gonna, if in 6 months we don't create objective improvement in weight and A1C or deprescriptions, we're offering 6 months of continued care free,
Hmm. That's
right?
good. Yeah.
And it's not good. It's never been done.
Hmm.
Never been done. We will be the first nationwide practice direct to consumer that basically saying, I'm not promising results. I'm saying if we don't produce these results and you maintain a glycemic variability less than 12 and you produce ketones of zero point 0.5 and you step on a scale and you come to your visits with your coach
Hmm.
and you don't get results, you don't pay. You don't pay after 6 months. We'll take care of you for 6 months.
Hmm.
Like, I guess I'm a terrible freaking grifter.
Hmm.
I
Yeah.
don't know.
Well, I mean, yeah.
Is
I mean, the
that
definition of a grifter is that you don't get results and you just leave town too quickly. I would say that the vegans doing this are the grifters. I mean, like it's like Chris Hemsworth, Liam Hemsworth, the actors. Liam Hemsworth almost died. I mean, he went to the hospital with acute oxalate poisoning because his vegan nutritionist told him to, go vegan, blah blah blah, and he was consuming such a high amount of oxalates that he almost died. He could have died. He had acute oxalate poisoning because he was drinking spinach smoothies every morning for 3 weeks. And he went into the hospital, he had to get surgery to remove these massive kidney stones, and got very sick of that, and then stopped doing that. But guess what? Did that guy go to jail? Did they talk? No, he's got a podcast. He writes books. And he's talking about how great he is and all these celebrities that he's worked with. He's just leaving a trail of destruction in his wake. But because he's already worked with them and they say, "Oh yeah, no, I'm feeling better," and then they recommend him to their other friends, and they just keep moving throughout the people, and that's what a grifter is. They go from town to town. They don't know him, don't know everything's bad, seems great, and then they're out of there before everything goes to hell, and they just move on like that. This is the opposite. You're saying, "Hey, look, if this is not working, I'll stay with you. I'll be there with you. We'll get you there." My business model is to get people so healthy they don't need me. And I tell them this. Everything's front loaded. There's a lot of education that goes up front. We're changing your lifestyle, we're changing these things. Deprescribing is a major part of my practice. And we get people extremely healthy over the course of months to, a year or more, whatever. And then after that, maybe I see them once every 6 months, once a year, something like that, if they, want to talk to me. It's like if everything's fine, that's fine. I've had patients come back to me 2 years down the track just saying, I'm just interested in sort of everything's great, everything's perfect. I just want to check my blood work again, just sort of curious. Like that, those are my patients. And so I have a high turnover because I'm getting them better, and they don't need to come back anymore. They check in once a year, once every 2 years. And so I know that they're still doing well. It's not that they've fallen off. So I have data going back, 6 years now doing this. And they're doing fantastic. They're doing fantastic with it. And I also know they're doing fantastic because I'm booked out for new patients 3 months, and everybody who comes in saying like, "Oh, want to come in here because, Rodney said to come in." Bethany, this and this and this. They're all saying it's all word of mouth. We don't advertise. I don't talk about this on my podcast or anything like that. I have a medical practice here in Perth. That's it. I don't advertise at all. I mean, we were talking about it. How I don't really take many affiliates or sponsors because I just want to keep that
Yeah,
separate.
maybe you could start with one though,
Yeah, I know,
Maybe you could
but
start with one.
but
Yeah,
but
but I hear you. Yeah.
yeah, but my point is I'm not even affiliate for myself. I don't even advertise my own practice, you know, and I don't need to because the people that I'm treating are getting better and they're getting healthier and they're telling their family and friends saying, "Hey, you need to go get sorted out because you're having trouble." So it's the strangest grift I've ever come across because it's like grifters leave town, grifters move on and bounce from people to people. We're staying put. We're staying right here. And you've put your money where your mouth is and say, look, if this doesn't work, if you do what we say you do and you get these numbers and you're not getting these objective results, we'll keep treating you for free. That's a pretty weird grift, is, by not taking money if your product doesn't work.
Yeah, I mean, we've been doing this long enough. We are huge on remote monitoring and
Mm.
telemedicine. Eventually we'll publish what predicts weight gain. We have some interesting data. You know, I think one of the things that we're really good at is um, being real time, accessible, and available, but it's a bit like Minority Report. If you've ever seen that movie of like
Mm-hmm.
pre-crimes, where we're analyzing, you know, like first of all, you're getting a real team that gives a crap, but we're come to a point where we're analyzing how people interact with their healthcare. Like if all of a sudden you were very interested and then all of a sudden not, you're getting on your scale every day, then aren't. You're using a CGM for a long time, then didn't. Checking your ketone and then stopped, right? Getting your labs, 3 times a year and then haven't gotten in a year, right? So we're looking at, can we predict when people, because this is an addictive food environment and it's very easy to just get sucked back in. So how do we protect people who are interested in maintaining their health but are constantly under attack by everybody from their coworkers to their other specialists? So we're very invasive, right? Our employer programs are 2 years. Some of them are 3 years, right? So we're on the hook for 3 years. If we don't get results for them, we're on the hook,
Mm-hmm.
right? So we are trying to push the needle as far as possible and get people at that moment when they need help and be available, establish such amazing rapport, be so trusting, be so indispensable, easy, and accessible that they could come to us and say, you know what, it was Christmas, I struggled, and now I'm ready to just go back and not spend 3 days or 3 weeks or 3 months, quote unquote, off plan
Mm-hmm.
and suffering, right? So we want to get people at 3 minutes. We want to identify them at 3 minutes. We want to help them by 3 hours and see them by 3 days, right? So that we just get them back to where they need to be. Why are we that invasive? Because we know how hard it is. That's the reality. We know how hard it is.
Mm-hmm.
I don't think there's a clinic that's published better weight results. So, I offer this competition to you. Do your 100 patients, compete with
Mhm.
us so we can learn from you and you can learn from us, right? Take your 100 consecutive patients and do it. And because um, that's the kind of like, you're a rugby player,
Mhm.
right? You know when there's another team and they've been practicing, you're like trying to get your team together and practice. Like there's nothing like competition of people like working together to do something special,
Mhm.
right? And David Unwin from the UK knew this, and he
Mhm.
published it. He said clinics like yours and mine and all around the world need to start publishing their data. We need to see if you are doing something special, which I'm sure you are. I'm positive you are,
Mhm.
right? Then like you could be Marshall, you could be Semwise, right? You
Mhm.
need to publish,
Yeah.
right? You need to put it out there. And we need to get together and then see what's working for you and you can review what's working for me and maybe we can. But I'll tell you, I think the idea of food addiction and maybe you're just allergic to this stuff.
Mhm.
Maybe you're just allergic. Like, diabetes is no better sign that you're allergic to sugar and processed carbohydrates. You're allergic, right? That everything you've been told about fruit being holy, no, fruit restriction has been shown to reduce fatty liver. People have reversed autoimmune disease getting rid of certain substances found in vegetable plant and plants. You know, there is a possibility. Why not do an elimination diet, right? Like,
Mhm.
this could be curative. There's case studies of people with biopsy proven remission. Right? I think this
Mhm.
level of vehemence is like the antidote to an addictive food environment, addictive and pretty malignant food environment, and a malignant medical system, or at least a malignant nutritional and medical system. So I think I'm still learning. I have a lot to learn. I'm still learning a lot about nutrition every day. My patients teach me every single day. But I am so dumb that I take no insurance money, never
Mhm.
signed an insurance contract, never taken money from the government. The government wants you dead. If
Yes.
they're paying out your Social Security, they want you dead,
True.
right? If they're paying your Social Security, they want you dead. If they're on the hook for your healthcare, they want you dead,
Mhm.
right? Why did cancer screening stop at 70?
Mhm.
Right? Why did they stop at 70? They want you dead, right? The medical organizations don't know any better, right? So it's on us. So this is a challenge to you, Dr. Anthony.
Mhm.
Come
Mhm.
talk at the SMHP conferences. Come, analyze your data. We'll get a statistician. We have a great research community at the SMHP run by Melanie Tidman. I don't know if you know her, but she's
Mhm.
amazing. You should have her on the podcast. She's
Yeah.
great. And we have 30 medical posters ongoing right now being worked on
Mhm.
and 5 papers through the SMHP community.
Mhm.
There's stats people just waiting for clinics like you to say, "Hey, we
Yeah.
we we want to show people what you're doing." And this is
Happy.
it's people like you and me. Like I know what it's like. You started your own clinic. You're doing this. You're doing podcasting. I'm there, man. I feel like we're brothers from halfway across the world, but you're a little better looking and you have a little more hair, you know. But let me tell you, like we have to push each other, I think,
Mhm.
because it's a disaster out there. It's a really
Yeah.
a disaster out there. And imagine if we were at our full potential.
Mhm.
Imagine if we had the resources to be at our full potential.
Mhm.
I mean, you know what it's like. I mean, like go to your rugby days,
Mhm.
right? What did it take to reach your full potential as a rugby, player? That's the level of support docs like you and me need.
Mhm.
I'm just curious, just tell me. I'm sure your listeners know, but like, what did it take to be an amazing athlete?
Yeah. I mean, obviously you have to have the work ethic involved. I mean, it doesn't matter. if you have the road in front of you or not, if you don't put in the work. But no, it's a bit harder in the US. I mean, it's not like football or something like that, where it's just you've got just everything geared up to make people successful. Rugby was a bit more difficult in America, but at the same time, you do have to have those people around you. You have to have other players and coaches that know the game and understand it and can coach you and teach you, and you have to be, an open vessel. I got very lucky in Seattle. There's just some amazing professional players that were astounding players, and some coaches that are big time professional coaches now elsewhere, but that they were living in Seattle for whatever reason. I mean, people that had just captained and coached the Fijian national sevens team and won the World Cup, then moved to Seattle because his wife got cancer, and they went to the Fred Hutchinson Cancer Research Center. And because of his fame in athletics, he was able to get a visa there, and they were able to get treatment there and live there, and they still live there. I grew up playing with him, and so I learned from one of the best sevens players in the world how to play sevens, and and so that I got very lucky. But yeah, you do need those
Mentorship,
influences.
community, work
Yeah.
ethic, right? If you're a doctor, you have the work ethic,
Hmm.
but the mentorship, the community, the resources, the
Hmm.
knowledge, the wisdom,
Yeah.
right? On top of the work ethic, right? And we have to make this. Otherwise, it's going to die with you and me. And I believe that,
Mhm.
I mean, look at Atkins was around decades ago,
Yeah.
right? And we had nothing. So let's start
Mhm.
let's make that. Let's make that community. Let's make that.
Yeah.
I mean, you're doing it probably with your podcast, and I know you have a community too, and I see you and your wife are active on social media,
Hmm.
Did I get it right? Is your wife? Sorry,
Fiance, yeah, we're getting married this year.
fiance.
But yeah,
Congratulations.
thank you. Yeah. But I mean, I've
Yeah.
spoken in San Diego, at least once, maybe twice. I
You
think
got to come
twice.
do it again then.
Yeah,
Come do it again.
definitely. Oh, I'd love to. And if I'd love to publish. I have so many patients that just sort of have, case reports and case series that we could do, things like that. Massive amounts of patient data. I just would need a statistician because right now it's just me sort of doing all this crap myself, and it's difficult when you work full time and you're at the clinic 60 hours a week, and then I'm doing my all my online work, and I'm writing a book. So I'm generally working 7 days a week until about 2 a.m. pretty much every single day. And so, we are actually getting ready to publish a case series on MS patients, about 10 patients who have not only reversed MS symptomatically, but clinically on MRI, they've actually shrunk their lesions 40, 50% in the first 6 to 8 months sometimes. One lady shrunk her lesions
That's
by
amazing.
50%, and yeah,
I'd
in
love to
6 months.
work with you on this, man. I'd love to be a
Yeah.
part of this if you need help with that paper. I don't know how far
Yeah.
you are.
We're just
Uh,
waiting for the final MRIs. That's pretty much it.
you got the IRB, everything's ready to go, or
I think
so you
so.
need
I'm
some
not the
help.
one handling that, but
Oh,
people like Adrian and Sotomoto and Nick
oh,
Norwood,
Adrian's
brother
helping you.
Sam.
Okay,
Yeah, they're
yeah.
helping, and so
And who is the second person? Sorry, Adrian's awesome, by the way. He's
yeah,
so
Adrian.
amazing.
Yeah, he
He's a
is.
really nice guy. Congratulations, Adrian, if you're listening to this.
Mhm.
He just had a newborn, so
Oh yeah,
wishing
nice.
well for him.
Congratulations. Yeah,
Um,
Nick Norwitz and his brother Sam Norwitz. Sam's been really, really helpful. Very busy kid. He just finished up his master's at Cambridge, and now he's just started his first year of medical school at Harvard, and he's helping writing up the majority of this. So really, really good work from all of them. So yeah, we're just waiting for the final MRIs to come in, basically. And we have a radiologist down in California who's going to look at everything and look at all the before and afters and things like that. But
that
it's,
sounds awesome.
yeah, it's pretty great. And just from a symptomatic point of view, all the stories are in. I mean, it's amazing recoveries. I mean, some of these people were very, very limited. Some were bedridden or in wheelchairs and now have much more normal life. Some are still in transition. Some are still working on that, but improving and improving massively. So yeah, that's going to be Brilliant. And I
If
think
I
that'll
had
be,
MS, the first thing I would do would be an elimination diet. That's
mm,
amazing. I'm so glad to hear that. First
yeah.
of all, huge props to Nick Norwitz, Adrian Sotomoda. They're just amazing, amazing people.
Mm-hmm.
They've both helped me so much and our practice so much. They were co-authors on a lot of the papers that I just talked about.
Hmm.
Um, and Adrian Sotomoda is just something special. Nick is also something very special. Just awesome, awesome people. So I'm
Yeah.
glad that I'm not surprised to see they're helping you.
Hmm.
And Adrian's actually part of that research community that I was talking about.
Yeah.
He heads it. He's a big help over there. So I can't wait to see this. That's going to be
Yeah.
great.
Well, yeah, I'm really excited too because we show that and you publish something like that, people have to sit up and take notice. You can't just say, "Well, I feel better." Yeah, but you probably just lost some weight or whatever. These lesions are shrinking. That's never been shown before. That's never been shown before, not to that extent. And so they would have to sit up and take notice. And I think that would very much justify getting funding for like an RCT for taking MS patients, or even just a interventional trial and just comparing it to traditional sort of the norms. But that would definitely, I think, spark a lot of interest and hopefully get a proper interventional trial going so we can say, okay, does this work for everybody every time? Let's see. But I think the main thing is, I mean, if you think about it, you have to sort of think when you start thinking about these disease processes, it becomes much more straightforward, at least in my mind, because okay, let's say we don't know what causes MS. I've got very good ideas on that, but let's say we don't know, and there's just this overactive attack and damage to the nerves. Okay, so you suppress that damage with anti-inflammatory drugs, with immunosuppressants, steroids, etc. But typically these don't shrink lesions. In fact, they're judged by their success is judged by how much does it slow the progression. It's going to get worse, but like some of these studies are like, okay, this drug compared to this drug in the next 18 months, which has the least new lesions. So it's going to get worse, but which one makes it worse slower, right? That's where we're at right now with medicine. So this suppresses the immune system, and it doesn't even do it all that well. It does not perfectly because things are progressing, but you never get the damage healed. So it can stop the damage and it maybe go in remission for a while, but it never gets better. Why the hell not? Right. So what does a carnivore diet do? Okay, you're eliminating out anything that could potentially cause that damage. So, I mean, this is going back to 1991 with Dr. Freed, who's an immunologist, who argued that the body is not actually not capable of attacking itself. None of this makes sense from an autoimmunity perspective. But every one of these things that we're seeing, MS, Hashimoto's, Crohn's, everything called autoimmune, every single one can be explained perfectly by the known effects of plant lectins in the body and what they do to the body and the immune response that they elicit. So 1991, he's already arguing that the cause of autoimmunity is actually plant toxins and lectins. Okay, I totally agree with him. And more, there's other toxins that can do this as well. Glyphosate strongly associated with it, etc. So, okay, carnivore eliminates all those things, and all of a sudden the damage stops. So it's like the anti-inflammatory, the immune suppressant sort of thing. But why is it shrinking? Why are these lesions repairing? It's really damn simple. What the hell is the myelin sheath made out of?
LDL increase. They showed this, right? So the
Mm,
cholesterol increase. They showed this in, I don't mean to interrupt. I feel like
that's
I'm
right.
talking with a colleague. You
Mm,
know, I like anticipated this a little bit.
mm,
You know, the there's MRI data. The first time I was like, it makes sense to have the highest LDL possible was in 2018 when I saw a meta-analysis in JAMA Neurology. And it wasn't a meta-analysis, sorry, it was a interventional study looking at diabetics with peripheral neuropathy.
mm,
And they literally were doing MRIs through their nerves.
mm.
And the higher the LDL in these diabetic patients, the better their nerve healing, the better their neuropathy,
Yeah.
right? So is that where you're going?
Oh, kind of. I mean, that's part of it. Yeah, but nutrition, right? Your myelin sheath. So MS is a demyelinating disease. People don't know what that is. You have axons, which are like your nerves, but there's also white matter in your brain, and these have to be insulated. So it's like insulation on a wire. You don't get cross signals, and you also propagate that signal faster, so it's a better signal. Babies are very clumsy and uncoordinated because their nerves are not myelinated, so they don't work as well. So this is a demyelinating disease which causes neurological dysfunction. And yeah, LDL is absolutely required. I know the study you're talking about where higher LDL says helped prevent and reverse diabetic peripheral neuropathies. But what else do we know that's involved in myelination? It's B12, it's D3, it's choline, creatine, carnitine, DHA, EPA, all these things that only exist
Yeah,
in
species
animal source
appropriate diet.
nutrition. Exactly,
Yeah.
right? So you can go on a steroid, you can go on prednisone, dexamethasone, whatever, and you can suppress that damage temporarily. But without the B12 and the LDL and everything else, you will never regrow that tissue. We have studies showing
You have
that
to
if you're
stop the damage and regrow and repair,
that's
right?
it. Yeah.
Two
Exactly
different,
two different things. Yeah, you can stop the
yeah.
damage, but you have to have the building blocks to repair properly, right? And so we know from various studies that if your B12 is below 500 picomoles per liter, which is roughly 650 picograms per milliliter in the U.S., that you can actually get demyelination of your axons because your body's constantly breaking down and being repaired, and B12 is required for DNA synthesis and new cells to form. And so if you don't have enough B12, you get the breakdown, but you don't get the repair. And so your myelination, the myelin on your axons are breaking down constantly. And if you don't have enough B12, you can't regrow them. So you get demyelination. And so we know that under 500 picomoles per liter, 650-ish, 700 picograms per milliliter, you can actually get demyelination. Now, the reference range goes from 150 picograms per milliliter to 900, 1,000. And it depends on each and every lab because all these labs, that's the whole thing of revolutionized medicine. If we actually used objective um, reference ranges instead of just averages for that lab, because the average person is sick and malnourished. 80% of the calories consumed in America and Europe and the rest of the world really are from plants, and plants don't contain B12. And so you have a vegetarian population basically, and you're checking their average B12 and saying, well, everybody's in this average. Well, it's an average. Of course, they're in the average, but all those people are deficient. So because everyone's deficient, now no one's deficient because it's hidden in that average. But if you're below 650, 700, you can actually get demyelination. Oxford University published a paper in 2008 that showed that under 500 picomoles per liter, 650 picograms per milliliter, down to like 300 picomoles per milliliter, 450, whatever, picograms, and lower, that people were actually getting so much demyelination of their white matter that their brains were shrinking by 2.5 to 5.5% every 5 years. And that's my theory as well. Why do our brains shrink? We accept that. We say our brains just shrink as we age, even though no other animal on earth sees this, none. And so we accept that our brains just rot out of our brains. Okay. But if we're losing 0.5% to 1% of our brain per year because we're in the normal reference range for B12, after 30, 40 years, your brain is going to be shriveled up. And if you look at case reports, there's a case report in 1997 of a baby with 6-month-old baby who's child of vegetarian parents who had severe atrophy. Well, that wasn't even atrophy, just failure of development of their white matter tracts in their brain. And so it's very, very shriveled atrophy. It looked exactly like an 80-year-old patient with Alzheimer's, well, with dementia. And then with daily B12 replacement, after 5 months, it swelled up significantly. It looked like basically a healthy 40-year-old brain, but it didn't look like a 1-year-old brain like it should have. And so, but that's so looks like an 80-year-old brain. A 6-month-old baby with severe B12 deficiency looks like an 80-year-old brain. So why are we calling that 80-year-old brain normal? Yeah, and then you give them B12, all of a sudden it looks like a 40-year-old brain 5 months down the track. So I don't think that's age-related atrophy. I think that's malnutrition over time. And I'll bring up the images here in a second, but that is why I think that people with MS are actually seeing reduction in their lesions because they're just getting the basic nutrition that we need. And so, working in neurosurgery, I've seen dramatic recoveries from a neurological perspective, more than I would have expected. Because normally we don't expect the brain and the nerves to heal all that well. Well, it doesn't surprise me now because we've been malnourished. We don't have these nutrients like B12 that are allowing your brain to heal. Like if your B12 is at a level that is so low that you are getting demyelination, how the hell do you expect to remyelinate your nerves from MS? I mean, it's not going to happen. It is just not going to happen. But then people do this and they're eating the fat, they're eating the meat, they're having some liver, they're getting their B12 and vitamin D up, and their DHEA and LDL and all that sort of, or DHA and EPA and LDL. They're getting all of those things up in proportion. Now the body can actually start healing, which we don't think is possible as doctors and clinicians because we just don't see it. And we think that the brain shrinking over time is normal because we just see it. It is the norm, but that doesn't mean that it is normal. It doesn't mean that that's supposed to happen. And so that's sort of my thought on this. I'm gonna share this with me while it's on my mind here, um, because I think it's really dramatic. So this you know this, but I'll say this for everybody else's benefit. This is very typical of a baby's brain. So all the gray stuff is just brain. These little dark parts here, those are the ventricles, and they're very small. So sort of small here as well. There's no space around the outside. There's no gap. It's like, oh, we have a little bit of fluid space. In adults, in kids, it's maxed out. It's pushing against the wall, and that's actually how the skull grows. The growth of the brain pushes out on the inside of the skull and actually grows the bones of the skull. So that's normal for it's like a 20-month-old baby. I think in that one. This is that case report. Okay, and when you zoom in like this, and you didn't know that this was a baby, that look, you tell me if I'm wrong here, but that looks very typical for like an 80-year-old brain. That looks pretty typical for
Yeah,
a
the big
healthy 40-year-old
big
brain.
ventricles. I
Hmm.
mean, I see like like you look at the edge, you could see that would be called, just atrophy of the brain. I mean, you
Hmm.
can see this in, I don't read CAT scans of the head, but you can see it right away.
Hmm. Yeah.
That's not a healthy brain.
No, it's not. But if you put that in front of a radiologist and said that's an 80-year-old man, is that supposed to look like that? You say, yeah, that's just a normal age-related atrophy. This would be very normal for a 40-year-old brain, 35, 40-year-old brain. And this one, there's no gap around the outside. Ventricles are very small. You can't even see the temporal horns. This one now you can start seeing that. It's already getting atrophy. There's space around the outside. The ventricles are a bit more pronounced. You're seeing more space here around the brainstem, pons, things like that. Now here, much more pronounced, much more atrophy, huge ventricles, big open, wide temporal horns. That's very typical for an elderly brain. But again, this is a 6-month-old girl of vegetarian parents with severe brain shrinkage atrophy due to B12 deficiency. This is a published case report in 1997. And so this is at 6 months old, where it looks like an 80-year-old brain. And this is 5 months later, so about a year old after daily B12 replacement. So a massive improvement on that. And if you flip those around, say, okay, that's a 40-year-old brain. This is a 40-year-old brain. This is an 80-year-old brain. Yeah, that's normal. That's normal age-related atrophy. But we know that this is B12 deficiency, and we know that B12 deficiency, even as an adult, you can lose 0.5% to 1% of your brain. If that's your brain at 40 years old, and you're losing 0.5% to 1% every year, yeah, you're damn right that's what your brain's going to look like at 80. Of course it will. But with proper nutrition, it doesn't have to. And what I think is also striking here is that this went from an 80-year-old brain with B12 deficiency to non B12 deficiency. Now it looks like a 40-year-old brain. Huge improvement. But it doesn't look like a 1-year-old brain. Why the hell not? Did they just lose out on their ability to develop normally? Maybe. But also, they're replacing B12 in their vegetarian parents. What about the vitamin D? What about the choline, the creatine, the carnitine, the DHA, the EPA, the cholesterol, the saturated fat? I bet her LDL is probably pretty damn low. It's not what you want when you're trying to grow a brain that is predominantly made out of cholesterol. So it's or largely made out of it anyway. So I think that that's why it looks like a 40-year-old brain instead of a 1-year-old brain like it should, because it's not just B12 that she's missing. She's missing all these other things. So when we have MS patients, I have an MS protocol that oh goodness, what's going on? I have an MS protocol that I put people on, and we optimize B12, we optimize vitamin D3, and we get into reference ranges that are the studies have shown are optimal. We certainly get them the hell out of that normal range that can actually still cause demyelination because you're never going to regrow your myelin without if your vitamin B12 and things like that are so low that you'll get demyelination. It's never going to happen. So that's what I think anyway, and I think that's why we're seeing the improvements that we are.
That's amazing. I can't wait till it's published. I'd
Mm,
love to see that. Gosh, I'd love to be a part of it. If you wanted an extra person to write some data up, I think having read all of Terry Walls's books, I always felt like she was missing something.
mm,
I think the data out there on lowering your carbohydrates further and elimination diets. I mean, if I had MS, the first thing I'd do would be a carnivore,
mm.
right? A
Yeah.
very strict carnivore, and I would sequentially just add things back in, maybe after a month or 2 months
Mm,
to see how I felt. Going back to what you said, when I looked at lectins first, I mean, maybe this was like 7 or 8 years ago. I saw some basic data on lectins in there suggesting a close relationship with autoimmunity, maybe mediated through the gut. Um, but I never like went back there. Should I go back there? Should I go back to
totally.
literature?
Yeah, definitely.
Yeah,
I'll send you some. I'm actually just writing a chapter in my book. It's all about autoimmunity and lectins and things like that. I'll send it to you and you can see what you think. I bounced
yeah.
this off of um, Professor Annalise Barron, who's a professor of biochemistry and biology, whatever at I forget exactly the field, but anyway, like biochemistry at Stanford. And she's been doing carnivore for like 5 years. She reversed a lot of her autoimmune issues. She was very interested in the fact that there's so many people like on Dave Mack's channel that have reversed so many diseases. I mean, he basically has over 1,000 case reports on his channel of people doing massive recoveries with carnivore and many that reversed MS. And so I ran that by her, my ideas about um, autoimmunity that I wrote in this chapter that I'll send to you. And she teaches postgraduate immunology, and she seems like that makes sense. And so I think that's
I've
something. I
seen
mean,
too many people improve with
mm,
elimination diets to,
mm,
whether
yeah,
it's the anti-inflammatory effects of ketones. I just haven't seen vegan elimination diets help. So I think there's something
mm,
to ketogenics that it's different. And certainly I think there's something to like the ketogenic state, you
mhm,
know, the anti-inflammatory effects that's have been seen. Just basic low carb diets have been shown to
mhm,
reverse Hashimoto's pretty convincingly,
mhm,
right? Like an unrelated. So it's either anti-inflammatory plus removal of some poison,
mhm,
right, or removal of some allergic agent.
mhm,
Um, I'd be interested to see what that is. What that is. I suspect you could figure it out just by doing a graded approach, like just doing low carb versus carnivore,
mhm.
right? And like measuring
Yeah.
you could probably figure out, okay, what is there but the problem is there's so much even our meat supply is getting really messed
Mm,
up with the atrazine and with the it's just so hard to be
mhm,
certain. I've even read, I mean, it's certainly less lectins, but the cow eats lectins, right? The muscle meat has lectins, right? I mean, tell me if I'm wrong here, right?
Well, animals have lectins. They don't seem to cause
Yeah,
problems to human health. It's the
yeah.
plant lectins that are a problem. And the good thing about eating meat is that if an animal is eating a plant that it's designed to eat biologically, it has the biochemistry to break that stuff down safely so that it doesn't get into the meat. When you start feeding them corn and soy and crap that they're not designed to eat, then that can cause problem. That can get into their meat and fat tissue, which is why I think that people with autoimmunity have a much better time when they're just eating ruminant meat, like, the lion diet of just red meat and water, because the ruminant digestion ferments and breaks these things down. Also, ruminant digestion seems to be able to take out glyphosate, which is strongly correlated with autoimmunity, could directly cause leaky gut, which could just let all these factors in the body in the first place. There is a study being done like that. It's just got announced that they're starting recruitment and trying to get help. Michaela Peterson, who obviously suffered with very serious rheumatoid arthritis as a kid, had two major joint replacements by the time she was 17, ankle and a hip, I believe. She complete remission with the lion diet. And she is working with a team in the US. I'm sure that, and I actually reached out to them and said, hey, how can I be involved? And so we're talking about that. But they're looking at exactly that. I think they're looking at rheumatoid arthritis and Crohn's as a large scale RCT, and like I've donated to it. I think I donated a lot. I think I put like $2,000 or something like that to their GoFundMe. I can't remember, but um, donated something, whatever. They're looking for about $500,000 in fundraising and to do like a large scale RCT. And the two arms are ketogenic, well-designed ketogenic diet and full online diet. So they're going to be looking at that. And I would expect that they will both help significantly, but the carnivore will do even better. And that's just what I've seen clinically. I've had patients on ketogenic diets doing very, very well, but they just can't kick the last of their autoimmunity. I've had 70% of my people that follow me and do carnivore now were at one point plant-based. Most of them stopped because of the health issues. Many of them were autoimmune in nature. I had one lady that I worked with who was Inuit by descent, in the First Nation up in Canada. And she had been carnivore basically for over 40 years because her daughter had extremely bad health issues, could not tolerate anything except meat. And so I said, well, that's fine. That's just what we normally eat anyway. Like her parents and their parents, really, that's all they ever ate. And so they just went back to eating meat. As a tangent, she actually spoke to me last year about how there's this rash of babies in the Inuit community that were having seizures. As soon as they weaned them off of breast milk, they all started having seizures. And I sort of asked them, I was like, well, it sounds like they're weaning onto something that was causing a problem. And she said, you know what? That actually makes perfect sense because there's a law now that requires us to go on baby formula once we stop breastfeeding, required by law in Canada to go on seed oil, sugar-filled formula, and they're all getting epilepsy and they're all getting seizures, and as opposed to eating their traditional diet. So her daughter was actually afflicted in the same way, had these childhood seizures. The only thing that stopped them was a ketogenic carnivore approach, just eating meat. And so as a result, she just ate meat for 40 years, right? But the problem was she still had four autoimmune conditions, four of them, just eating meat, but she's using spices. And so she's using spices and seasonings from plants. And she saw my thing about saying basically get rid of the last 5% of these plant toxins and you'll improve 95% of the way. And she said, there's no way that just a bit of seasonings are going to be doing this to me. But she said, all right, give it a try. She tried it. And within a month, her autoimmunity started improving. Now she's completely autoimmune free just from the spices, right? And so all plants have lectins to one degree or another. Some are worse than others, but they all have them. And so what I see in my clinical practice is when people even start adding spices or seasonings, some people are just so sensitive that will trigger an autoimmune flare-up. Michaela Peterson noticed that same thing. She went ketogenic, cut all these things out, massively improved her health, but was still having to stay on medications, etc. Went full just beef and water and gone. And she just said, this is stupid. I could eat a salad. Salads are fine. Salads are good for me. She had one salad and the next day, bam, had a RA flare up. And so that's why she's only been eating beef and lamb basically for the last 7 years. But that's where that comes from, because she had to. It was necessity. She couldn't even she couldn't even have a damn salad, right? And I see that all the time. I even have patients that are so sensitive they can't do chicken, they can't do pork because they don't have a ruminant digestion that filters this stuff out. It's very rare, but there are some people that are so sensitive that they actually have to have grass-fed and finished beef and lamb. And then they'll improve 80, 90% of the way with just beef and lamb, but they don't get rid of everything until they just go full grass fed and finished because there's just something is slipping in and causing a problem. So like you said, it's just an elimination diet. There is something causing a problem here. And so you just have to get rid of it. And it's not just one thing. I mean, they can come from all different directions. But we know that this is if this were just genetic and your body was sensitized to itself and your body was just attacking itself, why the hell would changing your diet change anything? You have antibodies towards your body. You can measure them. You can measure TPO, TG antibodies and Hashimoto's. You just see them, and yet thyroid function is improving. Why? Right? That should be damaging, but they're not. We have Hep B antibodies in our body. You and I have had to have these things working in hospitals. You have to get your titers checked and all these sorts of things. Make sure that they're up. Whatever. Okay, why? I don't have Hep B. It's not attacking anything. It's there, covering surveillance, right? We see this in celiac. It's very straightforward. Celiac is called an autoimmune disease. We consider an autoimmune disease for decades. Now it's called a gluten-mediated autoimmune disease because when you don't have gluten, you don't have the disease. Well, that means that it's not autoimmune, isn't it? Because gluten, it's not a lectin, but it sort of acts like a lectin. It binds, all lectins uh, are glutenants, right? So like wheat germ agglutinin and hemagglutinin, and they cause agglutination, cells sticking together, clumping up, and get dysfunctional and damaged. It's like the villi in your stomach or in your intestines, they can clump those up together. Gluten does the same thing, so it can act very similarly to these lectins. They can bind to the carbohydrate structures on your surface of your cells, stick them all together like glue, damage them, flatten the villi, reduce your nutrient uptake. Then your body responds very appropriately, in my opinion, because it attacks your body's getting attacked. So it says, hey, what the hell is going on here? So then it attacks that. And because it's attacking the gluten that's stuck to your cells get hit in the crossfire like collateral damage. Or the gluten or the lectins or something can actually bind onto a receptor. And now there's a new structure and your body doesn't recognize that as self. There's this part you, but part lectin is a completely new different thing. Then it attacks that. Or and we know this in celiac, that it actually can upregulate things like MICA, MICA, where it actually expresses, hey, I'm being attacked, I'm being dangerous, you need to come here, and your NKT cells will actually see that as a signal, say, okay, we need to take this guy out. There's something wrong with this cell, we need to take it out. We know that, we get that, we've proven that presentation on celiac specifically. So all these different things can be true. But for whatever reason, when the gluten is present, that elicits the immune response and you get serious damage to your gut. But once you stop eating gluten, all that damage stops and your gut heals completely within 4 to 6 weeks, even though the antibodies and immune system is still sensitized and is still flared up for up to 3 years after your last exposure to gluten. Okay, so those aren't autoantibodies. That's not an autoimmune disease because your body is still there, right? And if you were sensitized to this as if it were an infection, doesn't matter about gluten. Your body should just kill it, right? And that's how infections work. I mean, I've never seen someone with pneumonia that had relapsing, remitting pneumonia where your body just said, oh, okay, let's attack it. Nah, we'll take the weekend up. You're dead. You're going to be septic and die if your immune system takes a break, right? So why would it take a break if your body was sensitized to your thyroid or sensitized to your colon saying this is not self? Your body knows what self is. And when I took postgraduate immunology, in my undergrad degree, and that was very clear. It was your body can't attack itself. It's your T cells are matured in your thymus, and they're testing against every single antigen that your body can express. And if they react even weakly to any of them, they are killed. They're not put out in your systemic circulation. So they cannot. So this idea of molecular mimicry doesn't make sense because if you had something come in that was not self and you make an antibody towards that and that was able to cross-react with your body, you wouldn't need that intermediary because your body's already capable of making an antibody towards yourself. If you could make something towards something else that could cross-react, you could make something that could react in the first place. It doesn't need to cross-react. So that doesn't make any sense. And it doesn't respond like an infection either. If your body thought your thyroid was an abscess, it would never let up. It would never slow down. Those antibodies would just go up and up and up and up and up and up until the thyroid was dead. I don't know the last time anybody survived an infection that lasted, acute affection that lasted 10 years, 20 years, 30 years, 50 years. That doesn't make sense. You would be dead because it's kill or be killed. Your body either stomps out that infection or you die. Those are the consequences. Those are the stakes here. So none of that makes sense. And so what I've found is when you remove these lectins, you remove the glyphosate, you remove everything that could potentially cause harm, even though antibodies are elevated, the damage stops. And that's the key thing because the antibodies are there, but your body's not doing anything because they don't have anything to attack. Just like when the gluten's not there, there's nothing to attack. So when these lectins or whatever aren't there, TPO and TG antibodies have nothing to attack. Or antibodies for Crohn's or MS or whatever, they just don't have anything to attack. And so that is what makes sense to me. And that is certainly, at least it explains the observed phenomenon much better than the idea that the body has just gone rogue and started attacking itself. I went back to my old immunology textbooks and I looked for updates. There's no updates. Um, the chapter on autoimmunity is just like, yeah, the body can't attack itself, and yet somehow it is, and so obviously something's going wrong in that maturation process. We don't know what it is. We actually can't prove that it has, but something's happening, right? So there's no evidence for this. It's a guess, and that doesn't mean it's wrong, but it does mean it's a guess, and it doesn't actually support or describe what we're seeing. Because if your cells just matured wrong and you can just attack yourself, you wouldn't need, your body it would just be wide scale destruction. Your body can just attack the self. You would just shut yourself. You would just die. And changing your diet shouldn't change that because these cells are already there. They're not going to just die off. They're making out antibodies. And so even if you change your diet and that somehow changed the maturation process, like maybe these lectins screwed up how your T cells are matured, your T cells are already matured. They're already done, right? They're already in the circulation. So maybe you don't make any new T cell lines that can attack self, but you've already got the ones that can already attack self, and they're not. The antibodies are up. No damage is happening. They say, to support their side of it, talk about Graves' disease, where the Graves' disease antibodies can cross the placenta, go into the baby and give the baby hyperthyroidism, or you can take the plasma from someone with Graves, put that into another person or into a mouse, and that would stimulate the thyroid as well. So, okay, well that's what that is then. But you're talking about the plasma. So you're not isolating just the antibodies. You're taking the plasma, which could also have the lectins, could have glyphosate, could have all these other factors in there that are already giving yourself something to trigger off. Those are known to cross the placenta. We know that plant lectins, damage the placenta and damage that barrier between the mother and child and the placenta. We know that they can cross into the child. We know that they can cause kidney damage and other damage to the fetus when the mom's eating a lot of lectins. We know that already. So why would those same lectins or factors not be able to cross the placenta, go after the thyroid, and then those antibodies towards whatever that was then stimulate the Graves' disease? So, that toxic theory of autoimmunity is actually still that still is can be explained with those phenomena we see with Graves and so on as well. So, but I'll send you that chapter anyway.
Yeah, I'd love to read it. I mean, I think autoimmunity is just a costly disease. Metabolic illness is such a costly disease. Chronic
Hmm.
disease is so costly. I mean, I've stopped being able to count the amount of autoimmune disease I've seen
Hmm.
reverse or at least improve. But it's finicky, it's like results. I just want to be clear. I've seen the opposite. I've seen people do strict carnivore
Hmm.
for months and, they have psoriasis and it doesn't improve. A couple of times I've seen it completely remit,
Hmm.
and those people ended up having celiac. I think it was just not diagnosed.
Hmm.
Um, but I just, certainly there's hope. And
Hmm.
if you're out there with autoimmune disease, I mean, gosh, if I had MS, I would be going on lion diet right now. So I would do salt beef water for at least 8 weeks to see how I felt. At least. and if I had no improvement, then at least you learned you did it. The only thing to be careful is just realize that our drinking water, the makeup we put on, the things we put on, like, we're so manipulated.
Yeah.
The deodorant you use, the lotions you put on, so just realize that if you have an autoimmune disease and you're doing an elimination diet, you have to really go all in. So don't get discouraged if even the first time it doesn't work. I've seen one patient, we like literally had to like change like just go free of everything,
Yeah.
to see a change in her symptoms. So I think it's hard, but I think
Mm.
diet is like 90% of it.
Yeah.
And what do you have to lose? The
Mm.
worst comes to worst, you ate great food, reversed your metabolic syndrome along the way, lost a couple of pounds,
Mm.
I mean, you have nothing to lose, at least to try it. I
Yeah.
can't wait to read that study, and
Mhm.
I'm interested in Michaela's study as well. She reached out a number of months ago, but I wasn't able to, I don't think I was able to offer anything to them in terms
Mm.
of trial design. It's pretty straightforward, I think.
Mhm.
I'm thankful they got through the IRB, and I'm thankful they're raising
Mhm.
money.
Yeah.
So I can't wait to read your paper, and then hopefully in a
Mm.
couple of years we'll read her paper,
Yeah,
or
definitely.
maybe, yeah. It's nice to see people passionate about it, and fired up. We need more of this. And unfortunately, right now it's just the people who've have lived with it, like Michaela um, and others.
Yeah.
Anyway, it's 11:30 here,
Mm.
Dr. Anthony.
Yeah.
I gotta call it. I gotta call
All
it here.
good.
I
No,
gotta
I
get my
appreciate
sleep.
it. Yeah.
Yeah, listen,
Well, that's
thanks for
part of
having me, brother.
it's part of the
That's part of
story. Yeah.
metabolic health.
That's
Yeah.
it. Yeah, well, no, thank you. And I was just lastly to say I've seen that with psoriasis as well. So psoriasis is a bit finicky, but some people take like 6 months, 8 months. But you're right. Yeah, it's not just what you put in your body, it's what you put on your body as well, especially for skin conditions. If you're putting on lotions and this is and that's and whatever, that can all trigger that off as well. So you're getting rid of that. I've found a lot of people, especially the stubborn psoriasis patients, when they put on just beef tallow and they use no other skin products, that actually has helped a lot of people as well. And it wasn't until they did that they got an improvement. But yeah, thank you so much, Dr. Drew. I really appreciate it. You coming on. It was an absolute pleasure. I'm really glad we got to sit down and talk finally. Um, can you please tell us, the name of your practice and social media and where people can find you?
Yeah, the name of the practice is Toward Health, Toward Health, and social media. It's at Dr. Tro. I'm going to warn you in advance,
Mhm.
it gets ugly,
Mm.
um, but it's fun. Um, if you're in the United States and you're hearing this and you're looking for, anywhere in the United States, we're in 50 states, and you're looking for a metabolic health clinic, I think we're focused on metabolic health. I'd say we're experts in weight loss, diabetes, hypertriglyceridemia, food addiction, binge eating. We have many patients with autoimmune disease. I wouldn't say that we're experts in that area, but certainly we can help with a keto carnivore lifestyle and maintaining and adhering to that diet. I think that's where our
Mhm.
expertise may be of most benefit. Um, yeah, we're looking, we're trying to grow something special, a movement.
Mhm.
If you're a doc or a health coach listening to this and you want to get involved in the States with the SMHP, you can reach out to me, the not-for-profit medical organization. Yeah, and we have a nationwide screening program. Anywhere in the country, you can get metabolic labs and a CAC for a ridiculous price and reviewed by a metabolic doc. And I'm really proud about this, to be able to offer a low cost entryway point into a practice that was previously really difficult for some people to reach price point wise.
Mhm.
If you can't get us through your employer, like if we're working with your company, you get us for free, right? So if you're listening to this and your company sponsors you through with our program, you get it for free. But for most people, it's tough to afford us. We don't take insurance. But this nationwide screening program, I'm super proud of because it gets people the information they need to see if they have disease anywhere in the United States. And I don't know of anybody else that can do this but us. So super proud about that. And so if any of this resonates with any of you, reach out to Toward Health and or shoot me a message on social media, and somebody from my team will respond and get you set up.
Oh, good. All right. Well, we'll try to put the links to all of these things down in the description as well, so people can check that out and go see your website and social media for more. Dr. Tro, thank you so much. I really appreciate you taking the time.
Hey guys, thank you very much for taking the time out to listen to what I had to say. If you like it, then please like and subscribe to my YouTube channel and podcast. And if you're on YouTube, then please hit that little bell and subscribe, and that'll let you know anytime I have a new video out, which should be every week, if not more. And if you could share this with your friends, that would help me get the word out and let me know that you like what I'm doing. Thanks again, guys.